Yeah, so the aim of this project was to determine whether there were changes in neuronal complexity associated with chronic migraine. And so we used two different preclinical mouse models of chronic migraine or migraine-like pain. And basically what we did was to determine whether there were, how neurons changed after in these chronic migraine-like states. And so what we found was that, in fact, there was a significant decrease in neuronal complexity in pain and migraine processing regions, such as the trigeminal nucleus caudalis and the somatosensory cortex. And so then what we did was to use different ways to specifically directly change cytoskeleton dynamics using an HDAC6 inhibitor. And so essentially what HDAC6 does is that it's very important for acetylating tubulin and for deacetylating tubulin. And so acetylated tubulin is more flexible and less prone to breakage. Deacetylated tubulin is more brittle and more likely to break. And so if you use an HDAC6 inhibitor, you actually push tubulin into a more acetylated state. Therefore, it's more stable. And so since we noticed that there was a decrease in neuronal complexity, we thought, well, if we try to increase tubulin dynamics, maybe we're going to have, restore that neuronal complexity. So what we did was to, treat with an HDAC6 inhibitor. And in fact, we did see a restoration in neuronal complexity within these preclinical models of chronic migraine-like pain. And correspondingly, we also saw that these HDAC6 inhibitors had an anti-allodinic effect, or also decreased cortical spreading depression, which is a model of migraine aura. And so we sort of directly showed that if we manipulate cytoskeletal dynamics, we can then restore neuronal complexity, and we can also have this anti-migraine-like property. But I think what was really interesting is that we then tried CGRP receptor antagonist, which is, a known sort of therapeutic strategy for migraine clinically. So we used alcegepant within the same model. And what we found was that, we noticed that alcegepant within our chronic migraine model had an anti-allodinic effect, as you would suspect. But interestingly, it also correspondingly restored neuronal complexity correspondingly. And so it sort of suggests that maybe these alterations in neuronal complexity are kind of like a feature of migraine chronification, and that compounds that either directly or indirectly affect tubulin dynamics can then be sort of that's a characteristic of an anti-migraine-like therapy. So that's, that's pretty much what we found. And this work was recently published in eLife. So we really want to follow up these HDAC6 findings. HDAC6 inhibitors are being developed for the treatment of a number of different pathological states, including chronic pain, Alzheimer's disease, and cancer therapies. So, we sort of like to explore this a little bit further and see whether HDAC6 inhibitors could be an effective migraine treatment. And we're also very interested in digging deeper into this mechanism. So, how exactly is it that these chronic pain states are altering neuronal complexity? And, what are other ways in which we can try to restore that neuronal complexity, and kind of digging into the different cell types that change, and whether there's ways to prevent that type of chronification from happening.